there will be real life situations which patients will come across that they will need advice over. And who better to share that with than other patients who've probably been through the same situations themselves. So I think there are situations, particularly for chronic illness, where you're reviewing how you're managing it, that would really be very helpful. But contrary to that, I think that there are other situations where you just really want that confidential discussion with your doctor. And of course, there are embarrassing conditions. I joked about the piles earlier on, but I don't think that there are lots of conditions where you would want to be sharing those sort of details with anybody other than your doctor. People find it difficult enough to talk to their doctor about it, so talking to other people would be perhaps more difficult. So select what the condition is, select what you think you might be able to benefit from it, and let's try it. Yeah, I'm always up for trying these things. Of course, the reason why doctors want it, I would imagine in the main, is because we can see 5 patients at once, and that's going to help us dramatically with our overburn surgeries. Yeah.
You just answered my question. Sorry, Beth. Interesting, though, that what you're saying, though, the notion of, sort of not necessarily wanting to share certain things, because I would have thought that the Isle of Man is probably almost the worst place, because if you are in a group scenario, yes, you are essentially going to bump into them the next day in the supermarket, aren't you?
Yeah, but to be honest, those sort of conversations in the supermarket that I overhear are so there's very few secrets that aren't shared in Tesco or ShopRite, as far as I'm aware. You'd be surprised, Beth. You obviously don't hang around the ice cream counter long enough.
I'll have to rectify that immediately. Okay, we've got some thoughts from you on the idea of shared GP appointments. Pete says, shared appointments will never take place in the practice I attend, as at least one of the sharers would have had to have made an appointment. I don't know whether that's talking about the waiting times for getting an appointment.
Is, yeah.
And Kevin's been in touch to say, they say that these shared appointments are working in the UK, but being cynical, I wonder if they might just be saying that because it's going to be brought in anyway. One of the troubling things is that the sessions are to be run by healthcare assistants who are not trained, or support staff, also untrained, and a doctor might attend for an hour of a 2-hour session. As more illnesses get added to the list, how long before individual doctors' appointments will no longer be available? The people attending are to sign a confidentiality form, but how many people would actually go straight out and gossip? My wife and I both agree, says Kevin, that if this system is brought in over here, we will not attend doctor surgeries anymore, and if needed, we would probably go to A&E, and that is not the way to go.
I would agree there needs to be a great deal of education. There would need to be a change in the structure of the way we run our appointments. Can I just pick up one point? They talked about HCAs being untrained. That's categorically not the case. Our HCAs that work in our surgery are highly trained, very efficient deliverers of healthcare and also diagnosis. They do a lot of our blood pressure checks. They do a lot of the general sort of run-of-the-mill testing. They're incredibly valuable members of the healthcare team.
There is a question, though, because looking at the story in more detail, there is a question you're saying about how it would help from the doctor's point of view, because it would, sort of help get a number of patients in all at the same time. The sessions are actually lasting for up to 2 hours. That's not helpful, is it?
Okay, well, I've not read the detail about the length of the sessions, and I would agree that perhaps in the context of a normal surgery, of course, that's not going to work. But I think in the context of what I was talking about before, which are these sort of expert patient sessions, where you might have an evening session where you'd devote the whole evening to, I don't know, lung disease, people with emphysema and asthma, and have a nurse doing checks, but at the same time having a group scenario going on where people are talking to each other about how they've coped, how they're managing their medication. I can see that sort of thing working very well. I would see it as a parallel to the sort of traditional doctor's surgery. So I think the gentleman who emailed earlier on, be reassured, we are not going to stop seeing patients one-to-one. It's an incredibly important thing that's been going on for many hundreds of years, and I don't think we're going to stop it within the next year or two. But I think this could be an interesting way of supplementing the difficult pressures we've got in general practice and across the healthcare system in the island. So, yeah, I think it's well worth looking at.